Hi, I'm Pamela Hughes, and I have the pleasure today of sitting down with Dr. Triester, gastroenterologist at Scottsdale Healthcare, as well as my buddy and colleague, Ron Wolfley. And Ron, you recently turned 50. Yeah, and had a colonoscopy with the folks over at Scottsdale Healthcare. Tell me about your experience.
Well, Pamela, look, my colonoscopy, and every time I say it, I kind of laugh because it's like I'm carrying around my colonoscopy, or there's possession there, right? Look, it wasn't the best thing about turning 50, there's no doubt about that, but the procedure itself was absolute cake. I mean, thanks to Dr. Triester, and of course the people at Scottsdale Healthcare, Thompson Peak Hospital. I mean, it was so easy. It was in, it was out, literally, and I'm glad that I went.
Well, Dr. Triester, bringing you into the conversation here, how common is colon cancer, and why are screenings like Ron so important?
So colon cancer is a very common disease, and we're real happy that Ron came to see us and got this taken care of for him and his family. Colon cancer is the second leading cause of cancer death in the U.S., almost as common in women as it is in men, and getting colonoscopies performed can prevent the disease.
So talk about the ladies a little bit there. Should we be getting it done as well?
Yep, just as often. It's almost as common in women as it is in men.
Well, fear, that's the thing I hear about most, and Ron, I'm sure you hear about most too when it comes to getting this kind of procedure done. Talk to us about the procedure and what exactly happens.
Sure. So that's the thing that people always hear the stories about, and one of the things that keeps them away from getting a colonoscopy is concerns about what the preparation they have to do to get the procedure done. It's basically a one-day situation. The day before you're on a liquid diet, and then there is a bowel cleanse the night before that you have to do. It's nobody's favorite thing to do, but we need to do it so that we can see and do a good job for you. The day of the procedure, you come in, you put in an IV, you get sedation, you don't really remember anything about the procedure, and 25 to 30 minutes later, we've done what we need to do, and you can go home and eat.
Okay, so you go home, you eat. When do I got to go back and get this done?
Well, it really depends on a couple of things. One, whether we found anything, and two, whether you have a family history. Okay. So for average risk patients who have a normal exam, they're off the hook for 10 years. For patients with a family history, or patients in whom we find a one or two benign polyps, like in Ron's case, then we need to see those people back in about 5 years.
So Ron, people hearing the advice and the procedure that the doctor just described there still may have a little bit of fear as to whether or not they want to do this. What advice do you have for them?
You know, Pamela, I think with so many guys in particular, I think guys don't like being put in a position of being feeble. Guys don't like being at the mercy of others. I know with my own self that is certainly the case. And I would say to those guys, I would say it's time to get over yourself. You got to do what is right. You got to do what is right for your family. If you don't want to do it for yourself, do it for your family. Swallow your pride and go get your colonoscopy. 50 and fearless indeed.
Yes, and we have more information for you right now at 50andfearless.org. If you'd like, we also have that information available by texting the word fearless to 411-923.